Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf. We're joined by the Director of Metro Health, Dr. Claude Jacob, and this is our COVID-19 update for the San Antonio community. Some more improvements in our fight against COVID-19. The positivity rate now has dropped to 1.6%. Cases continue to go in a downward trajectory, and we're seeing gradual improvements in our local hospitals. We are at a low risk level for the first time since January 6, 2021, this summer, and we are seeing steady improvements. If you haven't already, please get your vaccine and complete your vaccine series. And if you know someone who hasn't yet been vaccinated, please encourage them to do so. All of our success so far in the fight against COVID-19 in this latest round can be attributed to folks getting vaccinated. So if you know someone who hasn't yet been vaccinated, please encourage them. And remember, you can get vaccinated at a Metro Health location, and you could be eligible for a $100 HEB gift card. Visit covid19.sanantonio.gov for a list of Metro Health vaccine locations. In terms of our case count today, we're reporting 155 new cases of COVID-19. Our 7-day moving average has also gone down to 185. We have lost we are reporting 3 new deaths this evening. And again, we have lost well over 4,000 and close to 5,000 our neighbors and loved ones during this pandemic. So please keep them and their families in your prayers this evening. In our local hospitals, there are 200 patients with COVID-19. There were 22 admissions in the last 24 hours, 88 patients in the ICU and 38 on ventilators with COVID-19. 79% of patients in area hospitals are unvaccinated, and we have 10 patients who are children. Very quickly on vaccines, Metro Health is continuing their efforts to get as many people vaccinated as possible, and as of today, 1.5 million people, actually 1,542,775 people of the eligible population have received at least one dose, and nearly 1.3 million people have been fully vaccinated. We're also reporting a new number, the number of people who have received a booster shot. That's 107,482 people since mid-August. We're making great progress toward getting our population vaccinated. And you may have heard today, CDC advisors unanimously voted to recommend Pfizer's COVID-19 vaccine for children between the ages of 5 and 11. If the recommendations are endorsed later by the CDC director, children could be eligible to receive their COVID-19 shot within the next several days. Parents are encouraged to reach out to their pediatrician offices, as they will be the first essential sites for COVID-19 vaccine for children between the ages of 5 through 11. Metro Health, along with the Department of State Health Services, is working closely with those pediatricians to make sure they have the appropriate vaccine allocations and to provide support they might need. Let me turn it now to Judge Wolf.
Well, thanks, Mayor. And things really have really substantially improved. And I really think we're on a downward trend in terms of COVID patients, in terms of positivity rate. Everything just is moving in the right direction, but you still need to be careful out there. As the mayor said, the CDC approved the vaccines for children 5 to 11 years old. I think the director, we're waiting on him to sign off today, but we've received 5,000 Pfizer doses at the Bexar County Hospital District, UHS. And we will start taking reservations tomorrow. And for the Wonderland site, I know many of you have gone out there to get their shots. I think we've done over 450,000 shots out there. So most of you know where the Wonderland site is, but you start making reservations tomorrow. If the directors sign off, we'll start giving vaccines to children Thursday and Friday. We'll be closed over the weekend, but opening them back up on Monday. If you want to get a reservation site, you can go to universityhealthsystem.com and start registering tomorrow. Mayor announced how many booster shots we've done. We've done about 22,000 of those, 22,270 of those out at the Wonderland site. The other thing that's going in the right direction also, and I've been tracking it since school started, over 207,554 children have contacted COVID while they were in school, and that number was as of October the 24th. But the numbers have gone down. We're at like 4,185 during that week. And from a high, we were running around 43,399. So that is also looking a lot better in schools. But this thing has taken a great toll on us. I was reading, I don't know whether you missed the article or not, but regarding Johns Hopkins University of a study of COVID deaths. Over 5 million COVID deaths have been found around the world, and probably much higher than that, because in some of the undeveloped countries they have not have the accounting system of what's happening. So over 5 million people have lost their lives to COVID. And in the United States, we had the highest number of any other nation, 746,000. So it's been a deadly virus, and one that it's just been horrible to get through. And the mayor and I think this is about 320 media briefings that we've done, and people that really paid attention and did right, they came out okay, but a lot of people didn't pay attention, and certainly the unvaccinated didn't in this last go-round, and that ran up a death toll of about 2,000 for every day across the United States. But that's going down to about 1,300. So moving in the right direction, but a lot of people are still going to get sick, and many of them are still going to die.
And that is the plain truth, Judge. And we do want to say thank you, though, to all the frontline workers, emergency healthcare workers, our firefighters and police officers, and everyone who's been toiling away, from the teachers to the grocery store workers during this pandemic. Your work has paid off, and despite the toll it has taken, we have saved many lives in the process. So thank you for your work. And we do want to remind you that this is not over, so to find a testing location or a vaccine site, please visit covid19.sanantonio.gov. You can also call the COVID-19 hotline at 311 and selecting option 8. And also, before we turn it over to questions, I do want to remind San Antonio families that the deadline to enroll in the federal child tax credit program, which could provide total payments of up to $3,600 or $3,000 per child based on their age, is November 15th. If you haven't filed taxes in the last couple of years, or you didn't receive a stimulus check, you can review your eligibility and enroll at getctc.org/San Antonio. Again, that's getctc.org/San Antonio. These payments do not count as additional benefits or income, so make sure your family gets the assistance you need. And again, thank you very much for doing your part. Please continue to encourage those around you to get vaccinated, wear a mask where appropriate, and again, do it for yourself, do it for your family, and do it for San Antonio. We'll go now to questions for Dr. Jacob, myself, and the judge.
Dr. Jacob, how do you envision the partnership between Metro Health and local school districts in getting 5 to 11-year-olds vaccinated? Will it look like it did for 12 to 18-year-olds?
Good question. As you know, we are very excited about the opportunity to get the 5 to 11-year-olds fully vaccinated. We are working in partnership with our area providers based on the guidance from the CDC, the Centers for Disease Prevention and Control. We are control and prevention. We are looking for ongoing collaborations with area pediatricians. We are making sure that we work with the school districts. We do recognize that there is a different perspective and a different experience that folks have had. But at the end of the day, we do know that area school districts are looking forward to getting the information from our department. We are working with the area providers, and we do want to make sure that we can ensure getting shots in arms for these kids. We estimate that there are about 330,000 children across the county in this age bracket. So that accounts for about 17% of our population. So we do applaud our partners on the ground. We do thank our healthcare providers in particular, our partners at the fire department, our partners with area clinics and the settings where we've done the pop-up clinics. But all that to say that we continue to soldier on, we continue to work with the school districts, and we're just waiting for final confirmation from the CDC, and we'll move forward.
Will parents need to bring anything special with them when they accompany their kids to get these shots, anything different because they are so young? What is that process going to look like for the parents?
So we are encouraging parents at least to provide the proof of being a parent or a guardian, but we are also making sure that we have the appropriate forms in different languages available to at least support these parents. So at the end of the day, we are working with the school districts, with the area providers to make sure that they can access this free service to ensure that their children are vaccinated.
Will mom and dad be eligible for a $100 gift card from HEB if they get their kids vaccinated?
Yes, the mom and dad and the children themselves will be eligible for the gift cards. We have administered over 1,700 different gift cards over the course of the last few weeks. This has been a very exciting and successful program. We know that we've seen the interest. It's helped us to at least ensure that we get shots in arms. So just know that we stay the course. We've thrown everything at this pandemic here locally, and we're pleased by the partnership, and we appreciate the support by our funders to make these incentives available to parents and folks across the county.
Just my last question for the mayor or the judge. What does it mean, I guess, as family men yourselves, to know that kids can now be protected in a way that they have not been before? And could you sort of describe the feelings you have about this particular moment?
Well, I was fortunate enough to have a child who's eligible already. He's 13, so we got vaccinated very early. But I can tell you from personal experience, knowing that he's going to school and with a lot of children, and it is a level of peace of mind that has been rare during this pandemic, to know that your child in school is able to be vaccinated. And so I'm grateful that we're here now, and I think it's a game changer that other parents will be able to have that peace of mind and get their child vaccinated.
Well, I've got grandchildren from 30 years old down to 4 and 7. The 4-year-old is getting real close to fit into that 5 category, but the 7-year-old will. And I'm sure that her parents will be getting him the shot. As I mentioned earlier, in school, over 200,000 children have contacted COVID. I believe I can't remember the numbers exactly, but many children that end up in the hospital, I think 15% or so of them. So COVID is not over. We may be going down in the number of COVID cases in schools, but still over 4,000 are happening. And so I would talk with your pediatrician, make sure you feel very comfortable about it, and then hopefully you'll decide to give them the vaccine.
Again, the last time we were at this risk level was early July, so just remember that. So we haven't seen this scenario for the last 4 months. So clearly what we've been doing has made a difference. We appreciate our diligence and our vigilance over the course of the last few months. We thank residents for being patient with us. We're not out of the woods by any stretch of the imagination. This virus loves company, and so we ask folks to pay extra attention over the course of the holidays, celebrate safely, let us know if you have any questions, and again, we thank you for helping us, at least as a community, to get through this experience. Be safe, be well.
We have one more question. How quickly can we expect vaccinations to be available for children between the ages of 5 and 11?
So at this stage, we're just waiting for a final word from our federal agency, from the CDC. So we are looking at the early part of next week. We will make sure to message out accordingly. But right now, no date certain, but just know that we're on the runway, ready for takeoff. So sometime next week, we'll be making sure those shots are available. We've already ordered the vaccines. We're waiting for all the pieces to line up, and including confirmation and the guidance from our federal agency.
All right, that's it.
Okay.
Thank you.